خلاص.
اتفضل.
The heart, anterior surface of the heart. This is the right atrium, the right ventricle, the left auricle of the atrium, left atrium, the left ventricle, the apex of the heart. The right ventricle leads into pulmonary trunk, pulmonary artery that divide into right and left pulmonary arteries, pulmonary trunk. This is the aorta, the ascending aorta, the arch of the aorta, branches of the arch of the aorta. The aorta arises from the left ventricle. The right atrium receives superior vena cava, the inferior vena cava, and from inside the coronary sinus of the heart. This is the cavity of the right atrium. This is the opening of the superior vena cava. This is the opening of the inferior vena cava. This is the coronary sinus of the heart. This is a tricuspid atrioventricular valve, tricuspid valve between the right atrium and the right ventricle. The right ventricle, the wall is thick than that of the right atrium, but thinner relative to the wall of the left atrium. This is the interventricular septum. This is the tricuspid valve between the right atrium and the right ventricle. Here is a papillary muscle of the right ventricle, papillary muscle. The tricuspid valve cusps, the chorda tendini, papillary muscles. This is the cavity of the right ventricle. Here is a pulmonary valve between the right ventricle and the pulmonary trunk, pulmonary valve. The blood enters the right atrium. The right atrium ejects blood into the right ventricle. Blood enters the right atrium through superior vena cava and inferior vena cava and the coronary sinus of the heart. Then the right atrium ejects blood into the right ventricle through the tricuspid valve. The right ventricle ejects blood into the pulmonary trunk through the pulmonary valve. The pulmonary valve separates the right lung from the pulmonary trunk, and then the blood will go to the right and the left lungs for oxygenation. On the base or back of the heart, this is left atrium. This is the left atrium. Receives the four pulmonary veins. Right and left pulmonary veins, 4 in number. Now this is the cavity of the left atrium, and the left atrium receives oxygenated blood from the lungs through the superior and the inferior right and left pulmonary veins. Then the left atrium ejects blood into the left atrium through the mitral bicuspid valve. This is the mitral bicuspid valve. Now this is the wall cavity of the left ventricle. The mitral bicuspid valve between the left atrium and the left ventricle. The thickness of the wall of the left ventricle and the interventricular septum. The papillary muscle of the left ventricle, Now the left ventricle will eject blood into the aorta through the aortic valve. This is the aortic valve. And then they pump the blood into the aorta to all the body, including the heart itself. The aorta, ascending aorta. Now from the ascending aorta, right coronary artery, and left coronary artery arise and supply the wall of the heart. The right coronary artery and the left coronary artery supply the heart with arterial blood. Right coronary and the left coronary arteries supply the heart with arterial blood. Again, superior vena cava, right atrium, aorta, pulmonary trunk, left auricle of left atrium, right ventricle, left ventricle, apex of the heart, this is the base left atrium of the heart, the inferior vena cava of the heart, the coronary sinus of the heart, this is the left ventricle, and this is the apex of the heart. Pulmonary artery, right and left, pulmonary artery from the pulmonary trunk, arch of the aorta, superior vena cava, inferior vena cava.